Hi, I'm Dr. Kelli Harding at Columbia University Medical Center, and I am joined today with Dr. Arthur Barsky of Harvard Medical School and Dr. Brian Fallon of Columbia's College of Physicians and Surgeons. And this is one of a series of segments on hypochondriasis. This particular segment is geared towards thinking about how in the world do you help when you've got this tremendous anxiety, and how do you help diminish that? So actually, why don't we go ahead and start with Dr. Barsky, because he's done a lot of the work on thinking about cognitive behavioral therapy towards treating hypochondriasis.
I think there are a number of things that people can start to pay attention to and observe about themselves, things that actually make their worries worse and make their symptoms worse. And then once you've identified those, you can begin to change them. So looking for stressful events in daily life that seem to bring your symptoms on, situations that seem to make it worse, people who seem to bring out the symptoms. People will notice that when they have to deal with their boss, their symptoms get worse, for example. If you can begin to identify stressful circumstances, then you have to alter the circumstances. You need to work on the stress. And certainly part of that is what people think about the symptoms and beginning to really pay attention to the thoughts you have when you first notice your symptoms, when you first start worrying about them, because those tend to be unrealistic and catastrophic thoughts. People often leap to the most unlikely but the most serious possible explanations and need to begin to think about the possibility that maybe that's not the case. And, for example, generate a list of more benign explanations. It could be stress, it could be dietary, it could be too much caffeine, it could be being out of shape. To begin to think about alternative explanations for the symptoms is often very helpful, I think. And to learn to distract yourself. That part of what happens is this kind of vortex in which people pay attention to their symptoms. They monitor themselves. It's kind of vigilance. And that just makes the symptoms worse, which further causes them to attend to them. And so you need to learn to begin to develop some reliable ways to distract yourself, whether it's a task that you pick up around the house or a mental trick where you start trying to remember all of the teachers you had, the names of all the teachers you had in high school. It can be an activity. It can be a thought. You can pick up a photo album and look through an album of old memories. But you need to begin to develop something that you can reliably turn to that will get your mind off your health.
I think also, first of all, it's realizing that you do have hypochondria is an important thing. And how do you know if you have hypochondria? Well, if your friends start to say you're a hypochondriac, or your family members saying you're worrying too much, or let's say even if you do have an illness, you might have diabetes, but it's in control, but you're worrying too much about it, or you have another illness that's in control, but you're worrying too much, that would be a sign that you may be suffering from hypochondriasis. The message I really want to convey strongly is that you can get so much better with the appropriate treatment. But that's the key, which is you have to get the appropriate treatment. And there are some doctors who are very good, therapists who are very good at working with the cognitive behavioral model of how to treat hypochondriasis. And there are others who aren't familiar with it. So you need to find a therapist who knows about that model and how to treat it. And the same is true for the pharmacologic treatment, the medicine treatment. Medicine can be enormously helpful, but you need to start at a low dose and gradually build up, and you need to be on the treatment for at least 12 weeks before you say it's not working. I've had so many patients come in and say, oh, I tried that medicine, it didn't work, or I had bad side effects. And it's most often that when they have bad side effects, it's because the doctor started at too high of a dose. I'm sure you've seen that. Or it could be that after 3 weeks they felt they were not better, and what's the point of taking this medicine? I don't want to take a medicine. And so they stop and say it doesn't work. Well, in fact, these medicines often take 4 to 6 weeks before they work, and we know that the medicines can have increasing benefit over months. So in order to give a medicine a fair trial, like one of the serotonin reuptake inhibitors, you need to be on it at least 8 to 12 weeks. The most important thing is that you can get better. And don't be embarrassed about the fact that you have hypochondriasis. It's a real problem. It's a devastating problem for the people who have it. If your family members are making fun of you, have them watch some of these segments on hypochondriasis and learn something about it. Hypochondriasis is an illness that is real. It's an illness that can be treated, and you should get help for it. And we have this treatment study that's NIH funded. That's an excellent treatment study that you can learn more about on our website. Dr. Barsky, you actually have a book. Do you want to mention your book?
Yeah, much of what we're talking about actually is in a paperback book that's now out in paperback called Feeling Better. It covers a lot of the strategies we're talking about, and it is designed for people to do on their own. So if you're at a place where there aren't therapists available who are familiar with this sort of thing or comfortable doing it, or you want to try something on your own first before you go to see someone in the mental health field, it's very worth trying that, I think.
And Phantom Illness is a book that was written by Carla Cantor. I helped her a bit with the book, and it's a wonderful, wonderful book describing, with many case histories, what people experience when they suffer from hypochondriasis. She's a journalist who also suffered from hypochondriasis and talks about her own dreadful worries about lupus in particular, and how she ended up resolving the problem and getting dramatically better. And so hers is a story of hope as well as suffering. Finally, if you do have a mood disorder, make sure you get that assessed and treated, because people with mood disorders like depression, they over focus on their body often, and they catastrophize easily, and every single thing is colored in the darkest and the most dreadful terms, where you feel like you're dying and there's no hope. You feel guilty about your life and all the things that you've done wrong. And if you treat the depression, oftentimes the hypochondriasis can get better as well.
And it's good to know that there are good treatments out there, certainly to treat these disorders and to help people get back to their lives. Because as you mentioned, it sounds like a lot of people are really suffering with, they're not participating in the social things that they used to anymore, not hanging out with their family, maybe have run into trouble at work. And, that's part of the goal, is to get them back into being a part of their life. So I think we'll go ahead and conclude the segment there, unless you two have anything additional you'd like to add. Okay, great. And check out our other segments on this, and you're also welcome to check out our websites at the HealthStudy.com, and as well as the HealthStudy.com and the Illness Worry Study.
It's Illness Worry. It's www.illnessworry.cumc.columbia.edu, and I apologize for that.
All right,
awful
you got it
URL.
right. You got it right. All right, well, thank you.